Hello, it's Gordon Gregory from the National Rural Health Alliance. Welcome back, those of you who visit this website regularly, and if you've only just discovered the website, well, you've come to the right place to find out everything about rural and remote health in Australia, so welcome to you as well. We've just had the Council Fest, which is the annual meeting of our members of council who look after the Rural Health Alliance. We had about 30 of our 37 member bodies represented, which was great. Here in Canberra, we worked, would you believe, for 5 days, so we worked pretty hard. We went to Parliament House. We actually saw 53 parliamentarians on a day when some very exciting and surprising things were happening with the Liberal Party. So we were in the House taking messages on your behalf, so it's important that you know what we were saying. So I would encourage you to look on the news section of the website, which is I think somewhere up there above my head, and see exactly what we were talking about on your behalf with parliamentarians. I'd like to thank those parliamentarians who helped us get into the House, because it's a bit like Fort Knox these days, so many thanks to Minister Fiona Nash's office and the offices of Russell Broadbent, Warren Snowden, Jan McLucas, Senator John Williams and Richard Di Natale for helping us get into the place, which was great. We also, while Council was here, we also had an AGM at which a new executive was elected for the Alliance. Geri Malone, who's known to many of you, who's an experienced remote area nurse, is now our chairperson. You can actually see pictures and details of all of the council and board members of the Alliance up in that corner of the website, just up there somewhere. So do have a look and see who's now leading the Rural Health Alliance. A couple of important current pieces of work which I'd like you to know about. Firstly, we're just starting a new piece of work, for us new anyway, relating to the supply and distribution of food in more remote areas. Obviously, if one is unable to find food at affordable prices and a good quality, then it's very difficult to be and remain healthy. So it's not a new issue for the nation, but it's a new issue for us. So if you have views on food supply distribution, do let us know. You can always contact us simply by emailing nrha@ruralhealth.org.au. And the other one that I want to draw to your attention is a conference next April, the 17th and 19th of April next year, on caring for country kids. So we are working with Children's Healthcare Australasia, as well as all of those bodies in the National Rural Health Alliance, to run this joint event, which will try to see where things are at in relation to caring for the health and well-being of young kids in rural and remote areas, where of course many of the same deficiencies apply as for adults, and the implications for kids are obviously much worse, because if they have a poor start to life, then they're likely to have a poor health trajectory for all of their lives. So this is an important issue, and we bring together Children's Healthcare Australasia and ourselves. So do have a look at the website over on that side, I think, and see about caring for country kids. If you want to be on the program, we would welcome receiving an abstract from you sometime before the end of October. So that's a bit of a wrap for now. Do keep in touch. We need your information, as always, to make sure that we've got the right things happening within the Alliance. Remember, we're always working for you, so when I say we saw 53 members of parliamentarians, that was on your behalf, to try to make sure that they, parliamentarians, understand what the issues are for people living in remote areas. So keep in touch and keep informed, and between us we will do good things for people in rural and remote Australia. Many thanks.